What's up, guys? My name's Nick Sivrich. I'm a physical therapist, and I am here with this week's question of the week. This week's question of the week is about total hip replacements and why you have to have precautions during your activities throughout the day. Now, what I want to do first is actually go over what a total hip replacement is, because some people have questions about it. They don't know exactly what goes on about it. And what happens is when people have to get their hip replaced, usually it's due to pain, and it's mostly due to arthritis. And that's when the cartilage wears away in your hip, and now you have bone on bone. So with that, you need some sort of replacement because there's no space in the joint anymore, and basically the bone on bone is just rubbing constantly, and it's causing some inflammation. So what happens is they have to cut in the side of your hip, and basically they dislocate your hip to get that head of the femur bone, your thigh bone, out of the joint. So they dislocate it, they cut that head of the femur off, and they put a new head on there that's made of some sort of metal and titanium, and then they reshape the socket and usually put a piece in there as well, so that now you don't have that bone on bone. Then they put it back in the socket and they sew you back up. Now, it's obviously not that simple, but in a quick, informative way, that's what happens when you have a total hip replacement. With that being said, a lot of different doctors have different protocols that they like to go to with hip replacements. And depending on where they cut you, sometimes they cut you in more towards the front, sometimes they cut you more towards the back of your hip, will determine whether or not you will have some sort of precaution. And usually there's three that patients will have, and I usually go over with them on their very first visit. The first precaution is usually don't bend past 90 degrees. And basically that means, going to tie your shoes, put socks on, bend over to pick something up off the floor. And the reason for that is because you could re-dislocate that hip. Those muscles that they have to cut through are weak now. Everything is weak in that joint because they had to dislocate it. So that precaution is there. The other precaution, the second precaution, is don't cross your legs. Basically, you just don't want to adduct, it's called, your leg, because you could also dislocate your hip. And the third one is no rotation. So usually I tell people, if you're sitting at if you're standing at the sink doing dishes, just don't pivot on that hip. Don't rotate on it, because you also run the risk of dislocating that hip. Now, depending on which doctor it is, sometimes those precautions can last 3 months, sometimes they can last 6 months, sometimes they can last a year, sometimes doctors will say forever. I don't see that much anymore, and usually what I tell my patients is that usually about the 6-month mark, you can start trying to do different things, because those muscles are usually pretty strong at that point. But because of the dislocating of the hip, that's the reason to cut the head of the femur off. That's why those muscles are weak. They cut through them. So that's the reason why you have to kind of follow these precautions initially, just so you don't re-dislocate it. So I hope that helped this week, guys. I really appreciate, again, you guys checking out my videos and commenting on them, liking them, sharing them. I really appreciate it. If you have any questions, feel free to contact me. You can contact me on my social media pages. You can contact me on our company website, osptainc.com. I am at the North for Sales location. You can get on there and check out the location, get the number, and give me a call. So have a good week, guys. Thanks a lot.